Hi, Emily.
Hello.
So it's Medication Monday. What are we talking about today? Which medication are we talking about?
So I want to talk about Ambien.
Ambien. Okay,
Yes.
an oldie but goodie.
Let's just start with a broad question. What type of drug is Ambien?
Okay, Ambien is kind of like a class of medication called benzodiazepines. That's a big mouthful, right? Benzodiazepine is a medication that can be calming. It's also called a sedative hypnotic. But Ambien's different because it's kind of a close cousin of benzodiazepines. Benzodiazepines are like Xanax, Klonopin, or Valium, and those push on a receptor in our brains that calm us, and those are called GABA receptors. But the difference between benzodiazepines and Ambien is that Ambien just pushes on one subunit of the receptor, whereas the other benzodiazepines push on more subunits, therefore probably have more effect. And so Ambien is approved for use for insomnia. Briefly, usually you don't have folks on that every night. Some people take it that way. And again, this is not medical advice for anybody specifically out there. This is just me providing some psychological education on medications. So Ambien is also known as a Z drug because its generic begins with the letter Z, which is zolpidem. And then there's two other medications like Ambien, which is Sonata, which is Zaloplan, and it's also the other Z drug is Zopiclone, which is Lunesta. And the differences between Sonata, Ambien, and Lunesta is that Sonata has a short half-life, so it gets in and out of your system quickly. And then Ambien is like middle range; it's about 6 to 8 hours in and out of your system. And then the Lunesta is more like around 12 hours, so it might last longer. So that's kind of where Ambien lives in terms of its classification.
Okay, so if I was prescribed Ambien and I need to go to bed, when should I take it? Like 30 minutes before, an hour?
Well, again, this isn't medication advice for anybody out there listening. But what I tell my patients when I'm prescribing this is that they should take it after they're done with their bedtime routine. Usually, you would want to be in bed, sitting up with a glass of water, like a bottle of water. And I tell folks after you take it, within 15 to 30 minutes, you'll probably fall asleep. And they shouldn't plan to get up immediately after that. So the reason for that is Ambien can have side effects that can be dangerous. Imagine taking something like a sedative hypnotic, and you're watching TV downstairs, and you take it. If you took an Ambien and you weren't in bed and it kicked in, you could hallucinate. You could see visual things that aren't there, or like lampshades might move and wobble. You could fall down. Some people walk around and they might sleep eat. They'll like wake up on their kitchen floor with like a bowl of ice cream, that type of thing. And there's a rare kind of side effect of sleep driving your car, which is frightening. And that's what freaks people out. One of the main reasons why some of my patients won't take Ambien. However, if you take it safely and you don't have that side effect, of course, then you can utilize it for insomnia.
Okay. And so why are there those side effects?
That's a good point. I think it has something to do with how it's hitting the GABA receptor, perhaps the subunit. Like GABA receptors, if they're engaged, can wipe your memory a bit. So another something I caution my patients about is if they have a bed partner. Some folks will take Ambien and they won't remember being with their partner that night. They have to be really careful. So I usually tell them to tell their partner, "Hey, listen, I'm taking this medication. I'm going to be under the influence." Because some people wake up in the morning, they don't remember going to sleep, and that can be unnerving. To lose your memory and to be vulnerable. So that is an important thing to know.
Okay. And before I let you go, you mentioned the frequency of taking Ambien.
Yeah.
So people take it every night, or you said that they don't?
Yeah, typically, I think the FDA approval is only for brief insomnia.
Okay.
Some people use it for like resetting their sleep clock. Say they're having a stressful day and they can't get their mind to shut down and they're worrying and they have this. They may take it, but it's typically not to be taken every night. And the reason for that is some patients become psychologically dependent on taking a medication to help them sleep. Whereas I might want them to learn normal sleep, like have a normal sleep routine and habit. Um, and then over time, Ambien, you can become physically tolerant to Ambien, meaning it doesn't work as well as it did on the first few days of taking it. So you want to have it maintain its potency. And if you're taking it daily and it's no longer potent, it's like, well, what do you do then? So usually it's just something you would take as needed when you really need it. And I have some folks who take it a few times a week. I tell like a lot of professionals I work with, I'll have them take it on a Sunday night because their work week is stressful and they're kind of getting back into the work week, and they'll have like the Sunday scaries where they'll worry about the next day. And even worse is where these medications come in handy is if you've ever been up at night and it's like 1 a.m. And you go, well, I'm not going to be able to sleep tonight. Now you're worrying about not sleeping. You're not even worrying about your work the next day per se. It's more about like not getting sleep, because if you don't sleep, you could have a terrible following day. So that's something that we talk about a lot.
All right, got it. Well, I think that's all I have for you.
Okay, great.
Until next Monday.
Okay, see you next Monday. Bye.
Bye.